At 48, he was a picture of vitality, a non-smoker, a moderate drinker, a man who cherished his active lifestyle and was deeply loved by his family. Health-conscious and diligent, he never imagined that an act so personal, so tied to love, trust, and human connection could lead him to the stark reality of a cancer clinic. It began subtly, a sore on his tongue that lingered, stubbornly refusing to heal. He brushed it off as a minor irritation, perhaps from a sharp tooth or a spicy meal. But weeks later, when swallowing became a painful ordeal, he sought a specialist. The diagnosis was a shock: stage 2 oropharyngeal cancer, a malignancy of the throat. The cause? Human papillomavirus, HPV, contracted through oral sex. This is a reality many shy away from discussing. We live in an era where conversations about sexuality have become more open, yet linking sexual behavior to serious health risks, like cancer, remains a taboo subject. This silence is not just a cultural oversight, it's a public health crisis. Across the United States, Canada, Europe, Australia, and beyond, this reluctance to speak openly is costing lives, leaving men and women unaware of a growing threat. Oral sex is a common and natural part of intimacy for many. Research indicates that over 80% of adults in Western nations engage in it, often viewing it as a safer alternative to penetrative sex due to lower risks of pregnancy and certain infections. But this perception of safety is misleading. Over the past 2 decades, there has been a dramatic rise in head and neck cancers linked to HPV, particularly oropharyngeal cancers affecting the throat, tonsils, and base of the tongue. Health experts are now raising urgent alarms. In the United States, HPV-related throat cancers have overtaken cervical cancer as the leading HPV-associated cancer among men, a sobering statistic that underscores the shifting landscape of this disease. This isn't just about numbers, it's about human lives. Parents, partners, friends, people whose worlds are upended by a diagnosis they never saw coming. The human papillomavirus, once primarily associated with cervical cancer in women, is now driving a surge of cancers in men. The primary mode of transmission, oral sex. This connection, though uncomfortable to acknowledge, is critical to understand. Men face a disproportionately higher risk. A pivotal study in Annals of Oncology revealed that men are nearly 4 times more likely than women to develop HPV-related oral cancer. This disparity may stem from differences in immune responses, behavioral patterns, or the virus's persistence in male tissues. But the risk transcends gender, affecting anyone who engages in oral sex. The urgency for awareness cannot be overstated. HPV is not an obscure infection. It's the most prevalent sexually transmitted infection globally. According to the Centers for Disease Control and Prevention, CDC, nearly every sexually active person will encounter HPV at some point. For most, the immune system clears the virus within 1 to 2 years without any symptoms. But for a small subset, particularly those infected with high-risk strains like HPV-16, the virus lingers, embedding itself in the cells of the throat or mouth. Over time, it can trigger cellular changes that lead to cancer, often without warning until the disease is advanced. Unlike cervical cancer, which benefits from routine screening through pap smears, there is no standardized test for detecting HPV-related throat cancers early. Symptoms, such as a persistent sore throat, difficulty swallowing, ear pain, unexplained weight loss, or a lump in the neck, often emerge only in later stages. By then, treatment can be arduous, involving radiation, chemotherapy, or surgery, all of which can profoundly affect speech, swallowing, and overall quality of life. The physical and emotional toll on patients and their families is immense, transforming daily routines and relationships in ways that are difficult to anticipate. The weight of this risk can feel daunting, but knowledge equips us to act. Understanding how HPV is transmitted, recognizing behaviors that increase risk, and taking preventive measures can make a significant difference. This isn't about instilling fear. It's about empowering individuals with information to protect themselves and their loved ones. Vaccination is a cornerstone of prevention, The HPV vaccine, initially developed to prevent cervical cancer, is highly effective against the strains most commonly linked to oral and throat cancers, including HPV-16 and HPV-18. Health authorities in the United States, Canada, Australia, and Europe recommend vaccinating both boys and girls, ideally before they become sexually active, typically around ages 11 or 12. The vaccine not only protects the individual, but also reduces the spread of HPV in the population, creating a ripple effect of prevention. While it's most effective when administered early, adults up to age 45 can still benefit, though protection may be less comprehensive if exposure to certain strains has already occurred. Despite its proven safety and efficacy, HPV vaccination rates remain suboptimal, particularly among boys and men. Misconceptions, social stigma, and lack of awareness persist as barriers. Some parents hesitate, viewing the vaccine as unnecessary for their sons or associating it with promoting sexual activity. Yet, every vaccination is a proactive step toward safeguarding future health. Adults who educate themselves and discuss HPV openly with their partners contribute to a culture of informed health decisions. Risk factors extend beyond vaccination status. Research, including a study in JAMA Oncology, has shown that individuals with multiple oral sex partners face a higher likelihood of acquiring oral HPV. Men with more than 5 lifetime oral sex partners, for instance, have a significantly elevated risk. This risk is compounded by factors like smoking or heavy alcohol use, which impair the immune system's ability to clear the virus. These findings don't advocate for fear or judgment, but highlight the need for honest conversations about sexual health. Balancing the emotional intimacy of sexual relationships with their potential health implications is key to informed decision-making. Healthcare systems must also evolve to address this issue. Primary care providers, ENT specialists, and dentists play critical roles in early detection and education. Dentists, in particular, are uniquely positioned to spot early signs of oral cancer during routine checkups, such as unusual lesions or tissue changes. However, this requires training and a willingness to discuss HPV openly with patients. Breaking the stigma around these conversations is essential for both providers and patients to feel comfortable addressing the link between sexual behavior and cancer risk. Age doesn't exempt anyone from this conversation. While HPV-related throat cancers are often diagnosed around age 60, the virus can remain dormant for decades after initial exposure. A person infected in their 20s or 30s may not face symptoms until much later, making this a relevant issue for adults of all ages. For those over 40, it's a reminder to stay vigilant about health screenings and open to discussing HPV with healthcare providers. For parents and grandparents, sharing this knowledge with younger generations can be life-saving. A single conversation, though it may feel awkward, can plant the seed for prevention, whether through vaccination or informed choices. For those wondering if prior exposure to HPV means it's too late to act, the answer is reassuring: it's not. While past sexual activity may have exposed someone to HPV, not all strains are high risk, and most infections do not progress to cancer. Vaccination can still protect against strains not yet encountered, and lifestyle choices, like avoiding tobacco, moderating alcohol consumption, and practicing safer sexual behaviors, bolster the body's defenses. Regular health checkups, including dental visits, can also catch abnormalities early, when treatment is most effective. For those already diagnosed with HPV-related throat cancer, advances in medical care offer hope. HPV-positive throat cancers often respond better to treatment than those caused by other factors such as smoking or alcohol. Survival rates are generally higher, with many patients achieving remission with a combination of radiation, chemotherapy, or targeted therapies. Still, early detection remains crucial, as it significantly improves outcomes and reduces the intensity of treatment. This underscores the need for widespread awareness, not just among the public but within the medical community, to ensure timely diagnosis and intervention. The human element behind these statistics cannot be overlooked. Each case represents a person, a teacher, a sibling, a friend, whose life is altered by a disease they never anticipated. A mother who faces months of treatment, struggling to speak or eat. A partner who watches their loved one endure the physical and emotional challenges of cancer therapy. These are not abstract numbers, but real stories of resilience, loss, and hope. They remind us that health education is not just about facts, it's about compassion and connection. To protect ourselves and those we care about, we must take action. Schedule a conversation with your doctor or dentist about HPV and oral cancer risks. Ask about vaccination options for yourself or your children. Share this information with friends and family, not to alarm them, but to empower them. Small steps, whether getting vaccinated, advocating for regular screenings, or fostering open dialogue, can have a profound impact. This message is a call to break the silence. It's about recognizing that the most intimate aspects of our lives carry risks, but also opportunities for care and prevention. By embracing knowledge and empathy, we can transform these risks into moments of connection and protection. Let's commit to having these conversations, to learning and to living fully and healthily. The choices we make today shape our tomorrows. Let's choose wisely through awareness, action, and compassion. Let's talk. Let's learn. Let's live.